Question 51. What should the nurse do upon noticing that a fellow nurse frequently opens extra colloid dressings that are often discarded when not needed? A. Remove the colloid dressing from the shelf so that the nurse will find other supplies to use. B. Nothing, as it is not impacting client care. C. Tell the charge nurse to stop ordering these dressings. D. Discuss with the colleague the concern about wasting supplies. Correct answer. D. Discuss with the colleague the concern about wasting supplies. Wasting supplies like colloid dressings not only increases healthcare costs, but may also lead to shortages when they are needed for other clients. By discussing the concern directly with the colleague, the nurse can encourage more mindful use of supplies and suggest ways to minimize waste, such as opening only what is needed for the specific procedure. This approach promotes responsible use of resources and maintains a positive working relationship. Question 52. Which of the following behaviors is least appropriate when interacting with fellow staff members? A. Only report conflicts that interfere with client care. B. Provide input for performance evaluations. C. Serve as a resource. D. Provide positive feedback and constructive criticism. Correct answer. A. Only report conflicts that interfere with client care. All conflicts, whether they directly affect client care or not, can impact the work environment, team dynamics, and overall quality of care. Unresolved conflicts can lead to communication breakdowns, increased stress, and decreased team collaboration, which may eventually affect patient outcomes. It is important to address and resolve conflicts early, even if they don't immediately interfere with client care, to maintain a healthy and productive work environment. Question 53. What instruction should the nurse give to a client with pulmonary tuberculosis to obtain a sputum sample for a culture and sensitivity test? A. Cough deeply and expectorate into the container. B. Expectorate into a container after a respiratory treatment. C. Cough after pursed lip breathing. D. Save sputum for 2 days in a covered container upon waking up. Correct answer. A. Cough deeply and expectorate into the container. To obtain an accurate sputum sample for a culture and sensitivity test, the patient needs to cough deeply to bring up sputum from the lungs, not just saliva or mucus from the mouth. This ensures the sample contains the bacteria, Mycobacterium tuberculosis, for proper testing. Question 54. Which of the following statements made by a patient being discharged after recurrent kidney stones would be considered correct? A. I am glad to know that eliminating alcohol from my diet will prevent kidney stones. B. I will make it my goal to drink 2 to 3 liters of water per day. C. I will eat a high-sodium diet. D. I will eat a low-calcium diet because kidney stones are made of calcium. Correct answer. B. I will make it my goal to drink 2 to 3 liters of water per day. Patients with a history of kidney stones should eat a low-sodium diet and increase their water. Eliminating alcohol does nothing to prevent kidney stones. Question 55. Which of the following activities is not considered part of client advocacy? A. Involving the client in treatment and decision-making. B. Encouraging the client to advocate for themselves. C. Sharing your personal opinions to help provide additional information. D. Standing up for what is right for the client. Correct answer. C. Sharing your personal opinions to help provide additional information. The role of an advocate is to support the client's autonomy and ensure their wishes and decisions are respected. Advocacy involves providing factual, unbiased information and facilitating the client's ability to make informed choices based on their values and preferences. Offering personal opinions can create bias, influence the client's decisions, and compromise the ethical responsibility to act in the client's best interest. True advocacy focuses on empowering the client, not steering their choices. Question 56. The nurse is caring for an elderly patient and providing education. Which of the following actions would be least appropriate? A. The nurse allows additional time after each instruction to allow the patient to process. B. The nurse breaks up the education into multiple shorter sessions. C. The nurse provides supplemental written resources. D. The nurse speaks in a loud voice. Correct answer. D. The nurse speaks in a loud voice. Speaking in a loud voice is least appropriate because it is not necessarily effective in improving communication, especially with elderly patients. While hearing loss is common in older adults, speaking loudly can come across as condescending and may not address the root cause of hearing difficulties. It is more important to speak clearly, at a moderate pace, and ensure the patient is wearing any hearing aids or devices if necessary. Also, maintaining a calm and respectful tone is key to effective communication. Question 57. Which class of drugs is most fatal when overdosed? A. Antihistamines. B. Benzodiazepines. C. Tricyclic antidepressants. D. Typical antipsychotics. Correct answer. C. Tricyclic antidepressants. Tricyclic antidepressants are the most fatal when overdosed because they have significant cardiotoxic effects. Overdose of TCAs can lead to severe cardiac arrhythmias, such as torsades de pointes, which can be life-threatening. This is due to the drug's ability to block sodium channels, affecting the electrical conduction of the heart. Question 58. A patient receiving ziprasidone for schizophrenia develops Parkinson-like symptoms. Which medication should the nurse recommend to decrease these side effects? A. Benztropine. B. Bethanechol. C. Levodopa. D. Ropinirole. Correct answer. A. Benztropine. Ziprasidone is an atypical antipsychotic used to treat schizophrenia, but like other antipsychotic medications, it can cause extrapyramidal symptoms, EPS, which include Parkinson-like symptoms such as tremors, rigidity, and bradykinesia. Benztropine is an anticholinergic agent commonly used to treat Parkinson-like symptoms caused by antipsychotic medications. It works by blocking the action of acetylcholine in the brain, which helps to restore the balance between dopamine and acetylcholine, and alleviates the symptoms of Parkinsonism induced by antipsychotic drugs. Question 59. Which of the following is the most appropriate action for the PN to take when a quadriplegic patient begins to experience autonomic dysreflexia? A. Administer nitroglycerin sublingually. B. Check the patient's urinary catheter. C. Elevate the head of the bed as high as possible. D. Notify the physician. Correct answer. B. Check the patient's urinary catheter. Autonomic dysreflexia is often triggered by a noxious stimulus, such as a full bladder, and checking the urinary catheter is important to ensure it is not blocked or kinked, which can be the cause of the dysreflexia. This action is a priority before taking further steps, like administering medication or elevating the head of the bed. Question 60. What is the most accurate definition of ethics in nursing? A. Knowing your scope of practice. B. Advocating for the client. C. Being able to differentiate right from wrong. D. Being willing to report violations. Correct answer. Being able to differentiate right from wrong. Ethics in nursing involves making decisions based on moral principles and ensuring that care is provided in a way that is just, fair, and in the best interest of the patient. Nurses use ethical frameworks to guide their actions, uphold patient rights, and navigate complex situations that require distinguishing between what is right and wrong in various healthcare contexts. Ethics in nursing helps maintain trust and professionalism in patient care. Question 61. The middle-aged patient is seeking advice on strategies to prevent Alzheimer's disease. The nurse provides information about which specific diet that has shown promise in reducing the risk of developing Alzheimer's disease. A. Low fat. B. Low carbohydrate. C. Mediterranean. D. Keto. Correct answer. C. Mediterranean. The Mediterranean diet has been associated with a reduced risk of Alzheimer's disease due to its emphasis on healthy fats, such as olive oil, fruits, vegetables, whole grains, and fish. This diet is rich in antioxidants and anti-inflammatory properties, which may contribute to better brain health and cognitive function, making it a recommended dietary approach for Alzheimer's disease prevention. Question 62. During the prenatal care education session, the nurse advises a woman of childbearing age to increase her dietary intake of which substance can help reduce the risk of neural tube defects in her future children. A. Vitamin B6. B. Vitamin K. C. Vitamin B1. D. Vitamin B9, folic acid. Correct answer. D. Vitamin B9, folic acid. Vitamin B9, also known as folic acid, is crucial in preventing neural tube defects in developing embryos. Adequate intake of folic acid before conception and during early pregnancy helps ensure proper neural tube development. Health organizations recommend that women of childbearing age consume folic acid to reduce the risk of NTDS, which can occur in the early stages of fetal development, often before a woman even knows she is pregnant. Therefore, advising increased folic acid intake is essential for optimizing maternal and fetal health. Question 63. What type of heat loss affects a newborn baby the most immediately after delivery? A. Convection. B. Conduction. C. Radiation. D. Evaporation. Correct answer. D. Evaporation. Evaporation is the type of heat loss that has the most significant impact on a newborn immediately after delivery. because it occurs when moisture on the baby's skin evaporates, leading to a rapid decrease in body temperature. This is especially critical in newborns, as they have a high surface area to volume ratio and are unable to regulate their body temperature effectively. Therefore, managing evaporation by keeping the newborn dry and warm is essential to prevent hypothermia. Question 64. When creating a prenatal nutrition plan for a pregnant patient, which foods should the nurse highlight to ensure sufficient vitamin B intake? A. Carrots. B. Squash. C. Blueberries. D. Tomatoes. Correct answer. C. Blueberries. The recommended answer is blueberries because they are a good source of vitamin B, particularly vitamin B6 and folate, which are essential during pregnancy for fetal development and overall maternal health. Including foods rich in B vitamins helps prevent deficiencies and supports important physiological functions. Question 65. Which of the following is not included when calculating a patient's fluid intake? A. Ice chips. B. Jell-O tea. C. Pudding. D. IV fluid from an antibiotic piggyback. Correct answer. C. Pudding. Pudding, while it contains some liquid, is primarily a solid food and does not contribute significantly to overall fluid intake like clear liquids, water, broth, etc. do. Fluid intake calculations typically focus on liquids that are consumed in their liquid form. Fluid intake calculations generally consider fluids that can be measured in milliliters and have a direct impact on hydration status. Foods with high moisture content, like fruits or soups, may contribute to fluid intake to some extent, but pudding is categorized more as a solid due to its thickness and gel-like consistency. Question 66. At what angle should the needle be inserted into the skin when performing a venipuncture? A. 45 to 60 degrees. B. 0 to 15 degrees. C. 30 to 45 degrees. D. 15 to 30 degrees. Correct answer. D. 15 to 30 degrees. The needle should be inserted at a 15 to 30 degree angle when performing a venipuncture, because this angle allows the needle to properly access the vein while minimizing the risk of going too deep or missing the vein entirely. A shallower angle, closer to 15 degrees, is typically used for superficial veins, while a slightly steeper angle, up to 30 degrees, may be needed for deeper veins. This technique ensures that the needle enters the vein smoothly without puncturing through the opposite wall of the vein, which helps achieve successful venous access with minimal discomfort to the patient. Question 67. Which type of white blood cell typically increases in response to a bacterial infection? A. Neutrophils. B. Lymphocytes. C. Eosinophils. D. Basophils. Correct answer. A. Neutrophils. Neutrophils are the type of white blood cells that typically rise in response to a bacterial infection because they are the first line of defense in the immune response to bacterial pathogens. Neutrophils are responsible for engulfing and destroying bacteria through a process called phagocytosis. When a bacterial infection occurs, the body signals the bone marrow to produce and release more neutrophils into the bloodstream to fight the infection. This increase in neutrophil count is a common indicator of bacterial infection in laboratory tests. Question 68. Which statement made by the LPN would be accurate when caring for a female client with a cesium implant? A. Constipation frequently occurs as a result of having a cesium implant. B. Vaginal stenosis may occur as a result of this treatment. C. As long as you are comfortable, sexual intercourse may continue as normal during your treatment. D. You will likely feel hungrier than usual as a result of this treatment. Correct answer. B. Vaginal stenosis may occur as a result of this treatment. Cesium implants are used in brachytherapy, internal radiation therapy, often for conditions such as cervical or uterine cancer. One of the potential side effects of this treatment is vaginal stenosis, which is the narrowing or shortening of the vaginal canal due to scar tissue formation from the radiation. This side effect can develop over time after treatment and may affect sexual function or make future medical exams more difficult. It is important for the nurse to inform the client about this potential complication so that proper follow-up care, including vaginal dilation therapy, can be recommended if needed. Question 69. Which of the following meals would be appropriate for a client with celiac disease? A. Egg noodles with cream sauce and broccoli, oat cookie, almond milk. B. Chicken and rice, apple, and tapioca pudding. C. Turkey sandwich with rye bread, carrots. D. Granola and dried apricots with cow's milk. Correct answer. B. Chicken and rice, apple, and tapioca pudding. The meal of chicken and rice, apple, and tapioca pudding is appropriate for a client with celiac disease because it is naturally gluten-free. Clients with celiac disease must avoid gluten, a protein found in wheat, barley, rye, and some oats, unless certified gluten-free. Chicken and rice are both safe options, as they do not contain gluten. Apples are gluten-free fruits, making them suitable for this diet. Tapioca pudding is made from tapioca starch, which is naturally gluten-free. Question 70. Which of the following statements from a patient who has just returned from a thyroidectomy requires further assessment by the nurse? A. I have a headache. B. I hope I will be allowed to drink coffee now. C. My lips feel like they are tingling. D. My throat feels sore and my voice is hoarse. Correct answer. C. My lips feel like they are tingling. Tingling around the lips or fingertips is a common early sign of low calcium levels, which can lead to more severe symptoms if not addressed. The nurse should promptly assess for signs of hypocalcemia and notify the healthcare provider.